So in June 2022, Justin Bieber had his condition where the right side of his face was completely paralyzed due to Ramsay Hunt Syndrome. There were rumours and reports that he had contracted this due to the COVID vaccine, and given the evidence of COVID vaccines and other facial paralysis causes like Bell's palsy, that was a plausible theory. As a doctor, I've worked with patients who are claiming compensation due to COVID vaccine damage, and conditions that cause facial paralysis like Bell's palsy is on the list. But this is on a case-by-case basis, as there has to be overwhelming evidence that the COVID vaccine did indeed cause Bell's palsy, and not a coincidence, or other causes such as viral infection like COVID-19 for instance, or having risk factors such as diabetes, high blood pressure, being obese and other health conditions. There has been quite a lot of celebrity deaths, a lot of which have been unexplained, and mystery illnesses since the pandemic, and since the introduction of COVID vaccines. Of course, if you're a celebrity and you've had a major side effect of the COVID vaccine, which could be any of Pfizer, AstraZeneca, Johnson & Johnson, Moderna, you're probably not going to admit it's due to the vaccine for the sake of your career, which is worth millions, as you'd have more to gain than to lose. We're talking about sponsorship deals, movie deals, music contracts, partnerships. Basically, the establishment could do a Kanye on you. But back to Bieber. Justin Bieber released a 3-minute video on Instagram that he has been diagnosed with a rare syndrome called Ramsay Hunt, which is a very similar presentation to Bell's palsy. So Ramsay Hunt Syndrome can be misdiagnosed as Bell's palsy. In the video, he showed he was unable to smile, blink and move his face on the right side. In the video, he states, "As you can probably see from my face, I have this syndrome called Ramsay Hunt, and it is from this virus that attacks the nerve in my ear and my facial nerves and has caused my face to have paralysis. As you can see, this eye is not blinking. I cannot smile on the side of my face." Now, what is Ramsay Hunt Syndrome? Ramsay Hunt Syndrome is a rare neurological condition caused by the varicella zoster virus affecting the facial nerve, which is the same virus that causes chickenpox. After a person recovers from chickenpox, the virus can remain hidden in the nerve cells. Later, if the virus is reactivated, it can cause shingles, a painful skin rash. If the virus affects the facial nerve, it can result in Ramsay Hunt Syndrome. The first sign of Ramsay Hunt Syndrome is often a small rash as well as weakness on the affected side of the face and loss of facial expression. Other symptoms can include severe pain in the ear, hearing loss, tinnitus and dizziness. Some patients may also experience symptoms such as loss of taste or dry mouth. The severity of the symptoms can vary depending on the location and severity of the nerve damage. Treatment usually involves antiviral medication and corticosteroids to reduce inflammation. In severe cases, facial nerve decompression surgery may be necessary. If left untreated, Ramsay Hunt Syndrome can cause permanent damage to the facial nerve, which can result in permanent facial weakness or paralysis. Patients may also experience persistent pain even after the rash has healed. Chances of recovery improve if antiviral treatment is given within the first 72 hours of symptoms, with 70% of that group recovering completely, but this drops to just 50% if the patient does not receive rapid treatment. So do COVID vaccines cause Ramsay Hunt Syndrome? Well, there is no evidence that COVID vaccines cause Ramsay Hunt Syndrome. Dr. Anna Wald, head of the Division of Allergy and Infectious Diseases at the University of Washington School of Medicine, explains. Shingles, of which Ramsay Hunt is a type, has been reported to occur after COVID-19 vaccines, but it could occur within a few weeks of vaccine if you were to be considered potentially related. Thus far, it is not clear whether there is an increased risk for shingles after a COVID-19 vaccine. However, there is for sure an increased risk for shingles after COVID-19. Again, to be related, it would have to be within a few weeks of the infection. So Bieber's case of Ramsay Hunt does not seem to be related to COVID-19, which he had in February, and is also unlikely due to vaccine. Another research article states, in summary, current research does not confirm that Ramsay Hunt Syndrome is a side effect of COVID-19. As a result, any unestablished potential risk of COVID-19 vaccines reactivating shingles or Ramsay Hunt Syndrome is outweighed by the established known benefits of COVID-19 vaccines. Researchers continue to recommend vaccination against COVID-19 vaccines when eligible. Additionally, they also recommend that more studies need to be conducted to examine the relationship as vaccination rates continue to rise. Now, I don't know if Justin Bieber got facial paralysis or Ramsay Hunt Syndrome from taking the COVID vaccine, as we don't even know if he ever had the COVID vaccine in the first place. So I would say, based on the evidence that there is no link between COVID vaccines and Ramsay Hunt Syndrome, it would be highly unlikely, but not impossible. But I'll leave you to draw your own conclusions. Hope you enjoyed this video.